New this morning, after more than 3 years of social disruption and millions of hospitalizations and, of course, too many deaths, the COVID-19 public health emergency is officially over.
Yeah, we have finally made it, the official declaration expiring today. And you may be wondering what it exactly means for you. Well, here's our epidemiologist and Erie News Now correspondent, Dr. Becky Dawson.
First off, let's talk about the significance of the public health emergency's end.
So I think it signifies a couple of things. Number one is that, the emergency of COVID-19, trying to keep people from getting the disease. Once they get the disease, making sure that they have medications, everything. It's not emergent anymore. We really are at a place where we understand the virus. The virus has really slowed its mutation. So we've been dealing with Omicron and Omicron subvariants for 18, 19 months now. So the virus is kind of like slowing down its pace, and we really understand it well. So it's time to say that this is not an emergency anymore, and to kind of allow COVID to just be part of regular public health and medicine.
Specifically, what have we learned over the past 3 years or so?
Oh my gosh. Well, we identified a new virus within, a couple of weeks of it like really showing up on the international scene. So we understood its genetic code. Vaccines were developed immediately. We were able to get treatment options. So Paxlovid being kind of the central one that has really been super effective. But we've learned how to treat people once they're in the hospital. We've learned how to prevent disease, how to diagnose it. So much has happened. And I think most importantly is we've kind of woken up our communities to the fact that, communicable diseases, infectious diseases can disrupt every part of our society if we aren't paying attention to them and trying to prevent them.
What, if anything, will the average American notice about the end of the public health emergency?
So the average American probably won't notice anything related to COVID spread, getting sick. Even the news, I think, is going to kind of continue on at the pace that it's going. This is really going to hurt people who are using SNAP benefits for food, who rely on the government for healthcare insurance. So all of the emergencies all the declarations of emergencies allowed people to get extra SNAP benefits, to get their Medicare without having to fill out new paperwork or prove, that they're meeting the minimum, requirement for income. And that all ends. So it could really hurt the people in our communities who need the most assistance, who are living in poverty. They're really going to feel this. The majority of us really aren't. So it's really going to hit people who are suffering already hard.
Obviously, a lot of lives lost over the past couple of years. A lot of people have gone through, a lot of serious illness. But there have been some positives coming out of the pandemic. What, in your mind, has been the most encouraging thing that we have learned or that we have witnessed over the past couple of years?
So I think it's the first time that public health has been front and center during our lifetimes. And I think that that's really important. We have a big focus on personal medicine here in the United States, and to recognize that, our physicians and our nurses are super important, but they play a really small piece in this larger world of health. And health really is, the person who's sitting next to you on the bus, what's in the air at the grocery store, what's blowing in from Canada, the haze that's going to blow into Canada. So I think really opening our eyes that health isn't just an individual thing. It really is a community thing. And we all have to be taking care of each other in order to be healthy at the individual level.
And I think one of the things that we here on Erie News Now have learned over the past couple of years is how great it is to have you, Dr. Becky, source of information and helping to keep us safe throughout the course of the pandemic emergency, now officially over as of today. We certainly I thank you for all your help over the past couple of years, and of course we'll be talking again soon.
Take care.
Thanks, you too.